Hello, my name is Svitlana and I am a cancer survivor. So when the war started in Ukraine, it was in March 2022. So my son, I lived there with my son. When I heard this bombing during the first days, the rockets flew to Zhytomyr, they ruined one school, they ruined 10 houses. And I heard all those explosions by myself. Then he decided to send me to Poland first. We were taken to some place, to some city where we spent a night in a big gymnasium where maybe 500 people lived at that time. Then we moved to the Netherlands, lived there for 5 months, and then my daughter and her husband decided to help me come into the United States according to the program U4U, Uniting for Ukraine. It was several years in Ukraine when I felt that I had some problems with my cough. So I coughed for several years, and then I had visits with some doctors there, but because of the restrictions of COVID, it was not possible for me to see some doctors. So now I'm living with my daughter's family here in London. And as I had coughs all the time, I had an appointment with Dr. Golden, who didn't just prescribe me something for my coughs, but he decided that I had to go through some thorough medical examination. And after that, when I was diagnosed adenoma carcinoma in my left lung, we called the Anderson Hospital because Yes, MD Anderson Hospital here in Loveland. And I was very lucky that I had an appointment with Dr. Tcheng here.
When I met with Svitlana, it's much like most patients, when you hear the word cancer, it's a very scary thing. So what I did for Svitlana is what I do for all my patients, is I take it step by step. The more you understand as a patient, the better you can understand what we're doing for you and what options we have available for you. So a funny thing, I never thought about medicine growing up. One day on a trauma service, it just clicked that I had to do something surgical. I really loved it. And my wife will tell you that she's the one that told me that I would do that. Here at Banner MD Anderson, we have a multidisciplinary team, which is wonderful that we can come at cancer at all sides, all different approaches. For Svitlana, she was lucky enough, and we're happy about it, that it was an early stage that we can offer a surgical resection. And that can be a lot to take in at once, and so we kind of break things up over time, let her soak things in, and then we come back and discuss things again, and she can make good decisions.
I had fears inside me because I was diagnosed as lung cancer. I didn't know what to expect. But the moment when I saw Dr. Tcheng, when he shook my hand, so all the fears went away. So I decided, yes, this is the doctor that I had to be treated by.
So at first you can feel a little apprehension from her and her family, and once we got to talking and we kind of got a better understanding of what was happening for her, she kind of lit up, and she's very sweet and kind, and asked all the appropriate questions, and we got to know each other a little bit better. I know Svitlana had a great story about how she got here to the United States, and letting her talk about that a little bit helped open up and get us to where we are today.
I consider Dr. Tcheng to be like my relative. Yes, like a family member, because he's very compassionate and he's very attentive, kind person. And I want to thank you very much. Can I hug you?
Sure.